Welcome to another section of knowledge acquisition. Knowledge is power, health is wealth. I am going to take you on a journey now on our body. Our body is a fortress against diseases. The fear of pandemics and co is what is going around, that there's going to be another pandemic, stuff like that. But when you look at the human body from this video presentation and all that makes it up, then you will know that we are already prepared, apart from government being prepared, to help the human body cope with whatever stress that is unleashed by the enemy from outside the body. The body itself is highly protected. So going through this video, if you patiently go through it, you will look at the fortress as a building or with so many fences defense that is very difficult to penetrate. I remember vividly my Professor Weber, physiology professor at Unijust, saying that God has made a perfect machine. And when you look at the workability of the human body, you will agree very much with him. And that is exactly what I shall present, and also look at the laboratory aspect of looking at some of the things that should be there, that if they are there, then you are in top shape. Your body becomes very difficult to penetrate. If you like what you're listening to, please press the like button, subscribe, and you'll be notified every time the next one is out. Yeah, the human body, a fortress against disease. This is a very interesting topic, and it's there for us to outline and understand more. The outline, the foundation, looking at it from the perspective of a fortress. We have the foundation as the innate, the adaptive, and the passive immunity. Also, now breaking out from the original fortress with ophthalmia neonatorum, chlamydia, and juvenile jaundice. This is when comparing it, that the fortress is the mother's womb, and when the baby come out from that fortress, is what about the new fortress? Is it now is the baby without the fortress anymore, or it has the fortress of its own? That is exactly the point here. The rooms of a fortress, you are now, let's look at them as organs, and every door is a defense door, and these defense doors are to be seen as the adaptive immunity. Then the immunity markers evaluation in the lab. So if these things are not there, just like when you look at a home and there are certain protective mechanisms not there in the fortress, you want to provide it or declare that the place is not safe. And finally, the conclusion. Now, foundation of the fortress. The stages of building the human body immune system make it a fortress, like I said. Now, when you look at this body, this is the human body itself. You now look at the immune system. The mucous membrane in almost all the cells of the body. The tonsil is located up there. The lymphatic vessels are almost all over. The thymus, that is where the T cells are made. The skin all over, covering everywhere. The bone marrow, the lymphatic vessels, the spleen, the lymph nodes, the tonsil, they all constitute both the adaptive immunity as well as the innate. When you talk of the skin, you are more or less thinking of the innate immunity. Almost all organs are completely formed by about 10 weeks after fertilization, which equals 12 weeks of pregnancy. The exceptions are the brain and spinal cord, which continue to form and develop throughout the pregnancy, even till when one starts aging and dwindling in the immunity. This is the fortress. Well, the first fortress is the mother's womb. The environment, you can see, so covered, nowhere, nothing can penetrate. It's a fortress that you cannot penetrate easily. The area is provided, everything is provided in a way that will not affect the child, will not cause the child any discomfort, except the mother itself is immunocompromised, or there is a transfusion kind of reactions which usually comes out as jaundice. This is the baby trying to come out. The umbilical cord is shown and the passage where the baby will come out. Before birth, a baby is protected by the mother's immune system. So should anything happen, there is that passive immunity. Even after birth, for 6 months or more, the baby has not started producing its own reaction, the adaptive immunity. The baby physical fortress is formed and consists in the main the innate immunity, that is the protective coating, like a wall that prevents foreign invasion by any attacker that are many in the outside world. At birth, a newborn lymphatic system starts to respond to regular exposure to new antigens. The attack is regarded as antigen because that's how the immune system, the lymphatic system, sees all these foreign bodies. They are all proteinous in nature, and so they are classified as antigens, and that is the adaptive immunity that produce certain substances against it. The lymphatic system, as a part of the immune system, grows steadily until puberty, when a child growth slows down. Let's look at the lymphatic system. You now see the location of all these glands and organs. The spleen is part of the area. The thymus is where the T cells that really attacks cell, perform the cell-mediated response is. The bone is also part of it that forms the cell-mediated response. Both the B cells and the T cells. That's why it is shown here. The red blood cells, white blood cells, and the platelets. So they are all formed in the bone before they move all around in the circulatory system. The appendix, that is the thymus gland, and the tonsil. So the lymph nodes really more or less filter and does not allow all these attacking antigens to pass out. Once they enter in, then the lymph node will collate them and probably destroy them and make sure that they are engulfed and destroyed. Breaking out from the fortress, we are now looking at the baby coming out from the mother's womb. The birth canal is the first unfriendly environment exposed to the baby, because the baby would normally is in a cocoon and is safe, but now it has to come out because it has to live its own life. It has to be bigger than that environment. So you can see the first external environment is there that the baby faces with the hive, and that's the birth canal. That's how the baby is brought out. Now, contracted infection are pathogens like Neisseria gonorrhea that cause Neisseria gonorrhea causes ophthalmia, neonatal chlamydia too cause serious eye problems, that trachomatis, and even jaundice as a result of reactions are noticed in the baby. That is the first attack, where we may be concerned by saying, why is it only these few organisms that cause problems? That is because there is that passive immunity from the mother to that child that is protective, but the immunity does not protect, because the mother itself is not immune against Neisseria gonorrhea and all these organisms I have just mentioned. So they are serious pathogens
that will really cause problem anywhere there exists. And so the baby's high are seriously affected when they get this ophthalmia neonatorum, this passive immunity which I've mentioned earlier, that the baby is protected by the woman, especially when the mother breastfeed the baby, because you need to have this passive immunity. This is the ophthalmia neonatorum we talk about, when the baby passes through the canal and is now having to take the mother's Neisseria gonorrhea, especially, is almost causing blindness. So the clinicians have a lot of work to do in that. The first door as adaptive immunity. That's the next topic. And when you look through, you will see all the things that constitute the fortress in the human body. These are things that, like for example, the tonsil, the adenoid, these are more or less plants that prevent these, that they are part of the lymphatic system and prevent all these pathogens that are out to destroy, that they move them out of the system and make the system fluid, the interstitial fluid and all the fluid in the body, even up to the circulatory fluid, safe from all these dangerous organisms. So the life is well protected. What you have inside of you is more like saying the environment is very sterile, very kind, not harmful. But the environment of the small intestine contains the largest number of mucosal membrane, and that's because it's where many of these organisms reside. You can understand these two contain so many organisms, and so the lymphatic and the immune system has to play a serious role to make sure that they don't really cause problem. And then the lymph nodes are the swellings you usually see, very common in children, when it comes out almost like a big swelling, that is, it has contained the organism that would normally have gone round to cause more problem. The lymph node is around the armpits where you see swelling, and where the lymph nodes are, you can see the neck lymph node regions, and so on and so forth. So the immune system is a very perfect, a fortress against any attacking organism described as antigen. Now the immune markers evaluation. How do we know how well our immune systems are? The immunity that probably we have. Because if you don't have these cells, then they cannot perform the duty of protection against that fortress we are talking about. So these are the immune system cells. You have the monocyte. Majority of time you find cell full blood or complete blood count, of full blood count. Those days we call it, but now it's commonly called complete blood count, and the differentiation. So all these cells are differentiated there. So when you want to evaluate, you take your blood and go for complete blood count, and the monocyte, the eosinophil, the neutrophil all perform different roles, and the mast cells, the dendritic cells, the T cells, the B cells, the basophil, all of them are evaluated and seen. Normally, when there is an infection or a problem, they all proliferate at an astronomical level. So you find more of them in circulation or in the area that they are meant to be found, and that is the marker of infection, and also can be used that if it's present, especially if the person is not immunocompromised, all these cells are found. That's why you can find where they are doing the CD4 count, the CD8 count. All of these are to check if the T cells are there to create that necessary cell-mediated immune response. So you can also confirm the presence of these markers with C-reactive protein test, It's a marker of acute phase reaction and a sensitivity indicator of tissue damage from a variety of causes. So when you do the ESI, erythrocyte sedimentation rate, and you find that it shows a little response, values that are okay, then you know the person is in a good state. And if there is inflammation already, the result will show a value that represents that. Then you want to also check for the immunoglobulins, the IgG, the IgM, which is for the indicators of humoral response. That is when you have antibodies against certain organisms that the body will attack. The humoral response is the immunoglobulins, and that is why you have that. Then there is the IgA. It's an indicator of mucosa humoral immunity. I just mentioned the mucosa. When you talk of the salivary glands, it's part of where you find the IgA, and also when you're talking of the intestine regions and co. Then the macrophages. Free macrophages travel by a mobile movement throughout the body. They engulf things that are foreign, and then but all these they are labeled named differently. The alveolar macrophages in the lung, the histiocytes in connective tissue, the Kupffer cells, the macrophages in the liver, the one in the kidney is called mesangia, and the other ones in the brain, they has its own to an osteoclast in the bone. So these are macrophages. By way of conclusion, the human body is a fortress that can prevent common pathogens of the environment because there are memory cells. The B cells produces memory cells as well as plasma cells. The memory cell lives longer and is very specific, so that when next the organism or the pathogen or the antigen comes around, it's quickly recognized, and there is high proliferation to attack and destroy, so thereby preventing it from establishing itself in that environment or colonizing the environment. However, when the body is immunocompromised, like in the situation of HIV/AIDS patients or immunosuppressed by drug addiction, then the fortress becomes vulnerable, and that's what you now see these days. I don't know how the viruses and bacteria have mutated to the level of being able to now go after our defense mechanism. That's the dangerous aspect of the HIV/AIDS and other recent pandemics that are facing mankind. Vaccine regimens are usually taken to prepare memory cells for attack by pathogens to make them more formidable.